I was taught a long time ago, if you will listen to your patient long enough, they will tell you what is wrong. And that is absolutely the truth.
Welcome to another edition of Clear Light Connections, where we talk to the people behind the brands of Bay Area Houston. I have with me today Dr. Tonya Callender with UTMB, and specifically you are the director of the Women's Comprehensive Health Center.
Comprehensive Care Clinic.
Okay.
Yes.
Tell us about that endeavor and what you're doing there as a service for the Bay Area Houston.
So we are a women's multi-specialty clinic. We just opened in June of 2020, so we're approaching our 1-year mark. Exciting things are happening. We're continuing to grow every week, and we're excited about what we have to offer.
Yeah, and this is perfect timing. We're fresh off the heels of Mother's Day, and for those that don't know, May is Women's Health Month. So very timely that you're here, and we can have a chat about women's health. What are some of the things that you're doing at the clinic specifically to provide that kind of comprehensive health for women?
So in our clinic, we offer multi-specialties. I am there every day. I do gynecology. I'm a nurse practitioner, but I have a gynecologist who is a physician that comes as well. We have menopause in the clinic. We have colorectal surgery, dermatology, psychology. We have mammography and bone density all in our clinic, as well as plastic surgery. We have facial plastics and body plastics. So we're trying to do our best to offer most of the things that women would need. Anything that's not offered in our clinic is offered still in the same building. We have endocrinology, urogynecology, cardiology. So I think have everything pretty well covered in one location, which is our goal.
And so do you focus on certain age groups, or it's from a certain age all the way through? Basically
anybody. I mean, we will see some adolescents, 14, 15, depending on what they need to be seen for. You know, and at that age, we're starting to think about birth control, irregular cycles. And so they can start early all the way up until I have some patients that are 86 years old.
Okay.
So anyone in that age group, we are happy to see.
Okay, so all the way adolescents through well, I guess elderly, for lack of a better term.
Right.
So I know care would look different during each stages of a woman's life.
Right.
What should our younger females be looking for and really pay particular attention to when it comes to their health?
So in the 20s, if they are sexually active, and 30s as well, but mostly in the 20s, we're starting to do STD screening. At 21, we start Pap Screenings, so we're checking for cervical cancer. We're starting a lot of different birth control options at that age. There are many options these days other than taking pills. And then we do have pregnancy, starting 20s, 30s. We don't do OB in our clinic, but there is an OB clinic in that same building, and so patients can be seen in the same building as well for their OB care. But those are the main things we think about between 20 and 30. We also are trying very hard to get women vaccinated for the HPV. HPV is the virus that causes cervical cancer. Most of the times the pediatricians are starting HPV vaccines, 12, 13 years old, maybe even between as young as 9 and 10. But if patients haven't been vaccinated, we can now vaccinate up until the age of 46.
Okay.
And so we're trying to make sure that we get everybody vaccinated as well.
Well, great. So I've got 2 daughters, one in college, one in high school. So they kind of fit that demographic.
Right.
My wife just turned 50 this year. And she's going to hate me for bringing this up, but what should my wife be most concerned about when it comes to her health?
So at 50, we start colon cancer screening, so colonoscopy. We're continuing to do mammograms. We start mammograms at 40, and we recommend annual mammograms, not every other year. Continuing to do Pap screenings between 40s and 50s. And the other thing that women start to go through between this age, 48 to 51, is the average age for menopause. So hot flashes, different things like that are becoming very bothersome.
Yeah, like I said, she's going to hate me for bringing that up, but part of the job.
It is a fact of life.
Yeah, and so talk about the role that diet and exercise play in the overall health of a woman.
So I exercise and emphasize the fact that exercise is very important. It's not all about body image. It's about how you feel about yourself. It's not always about looking skinny in the mirror, but it's about being healthy. So exercise is very important. We recommend 150 minutes a week or 30 minutes a day, 5 times a week. So it helps for your heart. It helps for bone health, because as you go through menopause, you start losing bone density. It's bone strength that you're losing. So, and as you get older, you worry about bone loss for fracture risk going forward. So bone health is very important, and exercise is what helps to keep bone density. So it's very important for that as well as for your heart. So I think it's a very important thing. As far as diet, it's again more about being healthy. Things like a low-fat diet doesn't have to be. I know some people are doing keto and they have very high-fat diets. It's whatever diet works for you. But I would recommend more of a lower fat, definitely lower carbs, not a carb-free, but lower carbs, and lots of green leafy vegetables.
Yeah, and we've got lots of great restaurants in the area that can cater to that type of diet.
Definitely.
And we've also got ample opportunity in the Bay Area for places to exercise, wonderful parks.
Definitely.
A great number of gyms that we had one on the podcast that specializes in the over 50 demographic.
Right.
And you can't emphasize enough how important that exercise is. I know my mom, she's in her 70s and she still does all of her exercises, and I think it's contributed to her really being able to have a good quality of life.
Absolutely. And, even if you do get seriously ill going later on in life, exercise can help you to survive whatever you're going through much better. It's also very, very important to help reduce stress. A lot of the psychiatrists, they recommend that you do exercise to help reduce stress. And I have patients that tell me all the time, yes, I do feel much better. And we also have psychology in our clinic as well.
Okay. Do you have any, like a success story from a patient that really wowed you, that you kind of connected with and thought, oh, okay, this is exactly why we created this clinic?
Well, I have been doing this for a really long time, so I have lots of really special patients. But I'd say my most recent memorable event is a lady who is in her 60s, early 60s, but she was out on vacation. She called me up one day. A lot of patients have my cell phone number, which I do not mind in the least. So she texted me one day and says, I'm coming home in a couple of days and I'm not feeling well. Can I do some blood work? I said, sure, why not? So I ordered the blood work, and she went and got the blood work done. I got her labs that night. I was sitting in the clinic finishing up some charting, and I saw her labs. I'm like, oh, holy moly, what's happening here? So I called one of my friends. I said, what do I do with this? She said, get a CT scan. So I called the patient up. I had a CT scan ordered. We got it done the next day. Again, that next evening, I'm looking through my results, and I'm like, oh, crud, this is not good. So long story short, I ended up admitting the patient that night. Within 48 hours, she had a tissue diagnosis of pancreatic cancer. Oh. She is still doing well today. And so we have a very tight bond because we've gone through the struggles together, and we'll always see each other as very special.
Yeah, you brought up a good point, and that's that early diagnosis. And if the patient doesn't think that something's quite right, it sounds like you're very attentive to that.
Absolutely. I was taught a long time ago, if you will listen to your patient long enough, they will tell you what is wrong. And that is absolutely the truth. You may not get it right at the first, but as you just keep listening and get a few more questions, they tell you what's wrong.
Yeah.
So,
And so you're a nurse practitioner. So
Correct.
tell people that don't quite understand the difference between nurse practitioner and doctors. What's the basic difference?
so I have a bachelor's in nursing, and then I went and got a master's, and now I have a doctorate in nursing practice. So I have my own clinic. I'm able to see patients on my own, diagnose, treat. I do procedures in my clinic. I have a supervising physician, so if I have things that come up or, tests that I'm just like, am I doing the right thing? I can always go over that with him, and it's a great partnership. I'm trained on a nursing model, which I feel like is a little more holistic, but it's something that I have wanted to do since I was a little girl, and I still love doing it every day.
Yeah, and I may be biased because my mom was a nurse for years and years and years, and nothing against the doctors,
Right.
but the nurses seem to have that extra level of call it bedside manner, call it
Right.
whatever it is. But you mentioned it, the listening part, and I personally like to see a nurse practitioner when I can for
Well,
that very reason.
I love being a nurse practitioner. I've been doing a nurse practitioner for over 20 years. So I've got a fair amount of experience. Certainly could not do it without my partner physicians, who I've had great training. But it's such a special role to get to be able to spend that time with your patient that sometimes physicians don't have that extra time.
So I want to ask you real quick for maybe your top 3 health tips. But first, I have to go to Sherry Sweeney with the Chamber for some important announcements.
Hello, Clear Lake Area Chamber of Commerce members at Bay Area, Houston. May 20th from 6 to 9 is Epicurean Evening. This Taste of the Town will allow you to taste food from amazing restaurants in Clear Lake, Bay Area, Houston. You just buy 1 ticket, you eat all the food. If you're 21 or over, you get 2 beers. You get to enjoy a concert. The Rock the Dock Journey cover band Escape is going to be there as well. It's free parking. We hope everyone decides to come out and join us. All you have to do is go to clearlakearea.com to buy your tickets.
All right, and we're back. So before the break, I was asking you what would be your top 3 kind of health tips, since this is Women's Health Awareness Month. Top 3 things that every woman in any age group could do right now to improve their overall health.
So first of all, I think seeing your provider on an annual basis is very important. Making sure you've done the mammography, the Pap screening, colonoscopy, the vaccines that we recommend. So annual visits are very important. Second of all, I would say exercise truly is very important for long-term health. And then taking time for yourself and not trying to be the person that everybody relies on. And it's very important that you do take time for you.
So that's a big problem, isn't it?
Yes.
Women tend to be the nurturers, the care providers, and so they tend to neglect themselves in that process.
Right.
And so it's important that we continually remind ourselves that, hey, you've got to take care of yourself so that you can take care of everybody else.
That's right. And if you don't take care of yourself, you will not be good for them when they need you. So it is important for mental health, for your overall wellness, to take care of you.
Yeah, and I guess we talked about kind of the life cycle of, your patients, and so if we can start them young and make sure that they ask the right questions of their healthcare providers and see them on the annual basis, kind of set them towards that path on those good habits.
So one of the things that I think I'd like to mention is that we do Pap screening starting at 21. And the current recommendation is that we only do Paps every 3 years if the Pap comes back normal. And so I have a lot of patients say, well, I don't need to come for 3 years. Well, that's not really true. Even though you don't need the Pap every year, we like to see you once a year. And it's not so we can rack up numbers. It's that I get to know you better. I'm like, what happened in this past year? Are there any new issues that have come about? And I follow them more closely because I know them better. And it's easier for me to pick up on when something is wrong is if I know them better.
Yeah, and you mentioned, every year is good. And for a long time, I thought a year was a long time until this last year.
Right.
And things change pretty quickly,
Definitely.
especially with health.
Right. I think that we're more comfortable going longer between visits now But, during the pandemic, a whole lot of people got very ill because they were too afraid to go see their providers. So we want you to make that annual visit, even if it's just to come in and say, well, everything's good and I'll see you next year.
And so do you get a sense that people are returning back to the office visits and getting back on track, getting back on schedule?
Yes.
Okay.
We still have patients that are somewhat nervous, but we've done our very best to social distance, wear a mask, be vaccinated, and we're providing an environment I think that people are definitely more comfortable to come to. In our clinic, we're small, so we do not have packed waiting rooms, and so I think patients are very comfortable and feel very safe.
Yeah, and so I guess you'll be coming up on your 1-year anniversary of the clinic.
Correct.
What's been the biggest challenge of starting, a clinic from the ground up?
Social distancing in a pandemic.
Oh, pretty much for everybody.
Right, when they don't want to come to clinics. So
Yeah.
that's probably been our biggest challenge. But things are coming back to normal, so we're very excited about our growth.
And so what's your vision for the clinic, let's say 5 years from now?
To have every slot filled every day.
And how many slots do you have every day?
Well, it varies depending on what providers are there. But I'd just like to see, more numbers, basically. Yeah. I think we're doing really good work. We've had a lot of good feedback. I would just like to be busier as time goes forward.
Yeah, that'd be good for you and for the health of the women of Bay Area Houston.
Correct.
So anything else you'd like to share before we wrap it up? Anything that we need to know about what's going on at UTMB or at the clinic specifically?
We are a growing clinic. We're fairly small, but we offer a lot. And we're very happy with what we're doing and would like to have more people come and visit us. Even if you just want to stop through and see what we're offering, we'd love to have people come by.
And it sounds to me like you guys really give that personal touch. So if that's something people have been missing from, their providers, that they should definitely come and get to know you guys.
We do. And we have the same staff that we've been working together now for 9 years. And so we know each other very well. We know the needs of each other. And so we work together very well.
Yeah. And that comes up a lot on this podcast. Successful businesses, they have that tenure, that longevity of people working together, and then they become kind of this high-performing team.
Absolutely. And that's what we're trying to do and offer.
So now that we've talked about the clinic, please tell us where it's located and how they can get a hold of you.
We are at 250 Blossom, Suite 160. We're right next to the Clear Lake Campus Hospital. We're in a medical office building that sits right adjacent to that, and we're on the first floor. Can't miss us.
Well, outstanding. It's been a pleasure. Thank you so much for stopping by.
Thank you for allowing me to be here.
Thank you. Thank you for joining us for another episode of Clear Lake Connections. Please follow us on our social media, and you can find our recordings on all of the platforms. And if you want to learn more or become better at business, I encourage you to join the Clear Lake Area Chamber of Commerce so that you can help grow your business. Visit clearlakearea.com to learn more.